3. Start, ma'am. Just minute. Let it go live on YouTube.
Good, Mr. Sir, is that absolutely fine? Can we go ahead?
Yes, ma'am.
Thank you. A very good morning to all of you, and a very warm welcome to all the attendees, startup founders, faculty, institutes, dignitaries, and definitely the most important person of the session today, Mr. Muthu, who is taking us to a very dynamic journey of incubation and different systems in the current era. Let me take you through a brief introduction of what is Innovation, Entrepreneurship, and Startup Forum. This forum is set up very recently, in last 6 months, with the support of 205 plus individuals who have interest to contribute and strengthen innovation. We believe that we need to plant a seed of innovation. We need to create that kind of an ecosystem. And what we are doing is in isolation, it is very important that if we all come together, we can actually create a real impact by supporting each other, by coming together, and by networking. So the objective of our forum is to create and develop this kind of a system where we can imbibe leadership, business development practices, innovation to all these stakeholders. So whether it is policymakers, whether it is successful entrepreneurs, or the entrepreneurs at an institute level who need funding, we can connect, we can actually create that kind of an impact by coming together. Our vision is basically not only to promote the spirit of entrepreneurship among students, but also in the faculty. We believe in changing the timeline. It's always said that you can have your startup, you want to start, you can start at any point of time. If you need to start at any point of time, why not in college? Why can't we provide that kind of an ecosystem in college? Why can't we all come together? So there are colleges which has very good expertise in marketing, finance. There are colleges who are very good into technical. There are some people who can support into legal aspects. So all this kind of expertise are brought together in the forum. And currently we are meeting at Maharashtra level. And subsequently, we intend to go at a national and international level too. If we talk about it, always the most important thing, and we have been teaching our students, is the team. What difference anything makes, and if we talk about an impact, it's a team what makes a lot of difference, and that is what this forum will is all about team. So we have 200 plus faculty, startup founders who have joined hands, and there are more people who are coming up for this forum as a team part. But when we look at the core team of the forum, we have with us from industry, we have Mr. Shailendra Goswami. He is the person who brings a lot of industry perspective. Of course, we have a lot of other people also, but as a key connect from the industry perspective, we have Mr. Shailendra Goswami, the chairman and managing director of Pushkaraj Group. He helps us out with lot of expertise in different areas. When it comes to experience and insights in terms of support, and from an academics perspective also, because there are unique challenges every institute faces, and we need someone who can actually give regular guidance on those fronts. So we have with us Dr. Shrikant Kalurkar, who's the principal of Atharva College of Engineering, Mumbai. Another important area when we look at creating this kind of an ecosystem, incubation support is something which is very required, and which is why today we have a great resource person, Mr. Muthu, who is going to give us a lot of insights which we need. And but in our team also we have Mr. Suryakant Dodmise sir, who is an incubation manager at RIT TBI. He brings that kind of key perspective in terms of policies, in terms of funding, in terms of what kind of support we can get from government and different stakeholders when it comes to incubation or acceleration support at the institute levels at different platforms. Another person who acts in a team as a catalyst in taking people all together and support each other is Mr. Sanjay Jagtap. He is the head of ED Cell, DST NEMAT coordinator and assistant professor of math at JCPM's ICOER Pune. He drives the entire session activities at the forum. The next person, Mr. Sandeep Magadam, is a person who is very well connected with a lot of colleges and around 5,000 students across Maharashtra. He heads IIC, and he is also training and placement cell coordinator at GIT Ratnagiri, and he has that kind of a network which he brings, and he also identifies the lacuna when it comes to assessment of a student in terms of better jobs and those kind of skills which can be imbibed at a college level. So which will help. We are not only talking about creating startups only, we are also talking about better jobs, better placements also, and creating an entrepreneurial environment in respective institute. The next person in the team is myself. I'm Dr. Rakhi Sharma. I'm a convener for Incubator and Accelerator Center at Jai Hind College, Mumbai. I'm heading Management Studies Department at Jai Hind College, and I've been associated with a couple of startups at our college, which I've created in last 18 years of my work in the field of entrepreneurship. I'm also a master trainer with Vadvani Foundation, where I have done a couple of faculty development programs in the state of Maharashtra, Gujarat, and Madhya Pradesh. The next person is Mr. Sopan Aghav. He's the person who has actually brought a lot of new flavor and perspective in the forum with the Students Connect. He's a certified trainer. He is from Entrepreneurship Development Institute of India. He is working in MCA department at PCCOE College, Pune. He's also a DST NEMAT coordinator. So this is a small team, but I would not say this is the team. The team is all 200 plus, which is moving to 300 now. A set of people who have had trust and faith in us, and who all believed that we can plant a seed of innovation all together and talk about a lot of innovation and have a better ecosystem for the students, because we know what is happening currently in the economy. So we will talk about jobs, but we want to skill people all together by coming together and have similar vision and impact. So this is all from what is IES Forum stands for. And on behalf of IES Forum, I welcome the resource person for today. And we are also thankful to RIT Institute and the management of RIT Institute that who have come together and collaborated with IES Forum for the session today. Without wasting much of time, I would like to hand it over to Mr. Suryakant Dodmise sir to take the session proceedings forward. Over to you, Mr. Suryakant.
Yes, ma'am. Thank you for introducing our guest as well as IES Forum. So I'm Suryakant here. Just I will share my screen. Rakhi ma'am, please close it. So I welcome our Honorable Director ma'am from RIT side. So welcome ma'am, and welcome Sri Muthu sir. So for as a chief guest of this webinar, that is a role of the startup during the pandemic and future. So just I will call upon our director, Dr. Sushma Kulkarni ma'am, who is a creator of leadership within the leader. So just ma'am, please, I welcome you on this forum, our webinar, to showcase something about the RIT, what is the role model of RIT which is working in Western Maharashtra. So please, ma'am.
Yeah. Good morning to all. Am I audible?
Yes, ma'am.
Yes, madam.
Yeah. So good morning to all, and thank you, Dr. Rakhi Sharma, for that introduction about the forum. I also welcome all the dignitaries and the resource person today, Mr. Muthu Singaram. And I really appreciate all the efforts this forum is taking to plant the seeds of entrepreneurship, innovation, and give a basic thought process that how we can inculcate this thought of innovation and entrepreneurship skill sets in the students when they are studying in the college. So talking about RIT, a role model in Western Maharashtra, I will not say we are role model, but we are emerging because we are focusing on different things in education, different verticals in education, which will have a holistic development of the students. So like we have ranked in the ARIA in 25 to 50 band. We have ranked in NIRF ranking survey between 200 to 250 band. And in our being autonomous institute, what we are trying to do is the academic discipline or the innovative curriculum which will develop the students, because we believe that it is design, delivery and evaluation of students which will make a huge difference in the outcomes of our education system. So these are the three factors which we are very much focusing. Second vertical which we focus is the industry interaction or liaison with the industry in terms of internships, live projects, the problems from the industry which are solved by the students and the faculty, patenting, those sort of things which we are trying to connect with the industry and go for it. Third one is about research, consultancy, innovation, entrepreneurship, startups. So that vertical is also now a big focus, because we have around 45 patents today. We have around 6 to 7 products commercialized. We have around 10 startups on our campus, and with infrastructure, I think that Mrs. will explain you later. So it is all integrated, I will say. It's not we will keep one from other, is a different thing. So research is connected to consultancy, research is connected to teaching, learning and academics. So everything is interconnected. So these are the different verticals which we are trying. And the fourth vertical, I will say, is involving and engaging the students through different clubs. So it can be sports club, it can be cultural, it can be music, dramatics, satellite club, or the Supra Baha clubs, or the cycle efficacy club. So different clubs are operating on the campus, which keep the students connected together with the vision that they have to aim for holistic development. They have to broaden their vision, and in total, the product or the students or the graduates who pass out are either employable in the industry or become entrepreneur, think of entrepreneurship, or think of higher studies, or think of competitive exams and start preparing for it. So with this, these are some of the efforts, I will say, to develop a role model in Western Maharashtra, so that the graduates who pass out are contributing positively in the society for the development of nation. Thank you so much. Mr. Sir, back to you.
Yes, thank you, ma'am, for introducing our RIT for Western Maharashtra. So really, we have a visionary director, ma'am, who is really a leader of RIT, and because of her only we are going to work in the leadership. So that's what I want to tell you about the our visionary director, ma'am. Just I will introduce within 2-3 minutes about what is the initiative we have taken in our campus. That is the first. We have previously we were having the incubation center. Now we are connecting that incubation center to innovation center, which is having 3 verticals. One is a RIT TBI, that is a technology business incubator. Then living labs. Under living labs, we are having 3 verticals. That is a building autonomous electric vehicle, IR AEV. Then industry revolution 4.0 IoT. We are taking the smart campus problems as well as the problems from the industry, and with that problems we are trying to develop the product and delivering to the industry by taking some charge of the consultancy. So that kind of things which is happening in RIT. Then engineering exploration, this is one of the living lab which is made for first year students. All students are going, first year students are going for learning basic fundamental. Here the teaching learning is happening in 2 ways. One is in learning studio, where 4 faculties are teaching at a time to all the students, and they are assisted by 2 lab assistants. So another we have in this under this we have tinkering lab, where the students are going with ideas and coming out with the products. So all the facilitation is there under this engineering exploration, where we have invested around 40 lakh rupees in the infrastructure of all this engineering exploration. So another vertical that we have created, and it's working fine for school dropouts. Even RIT is going to give education to engineering students, then MBA. So out of that, what can be done for school dropouts who are 8th fail, 10th fail, 12th fail? So for that, we have opened skill development center in 2017. Really, till date, so there is one spelling mistake. So please understand. So really, it is going to make the students' life who are school dropout. So in last 3.5 years, we have given training to around 1,000 students who are school dropout, and it has generated around 80 lakh rupees of turnover. And out of that, 70 lakh rupees already we have generated physically on the account. So that is exactly the innovation center which is working for us. This is a structure which are framework which are going to showcase to in innovation center, that is RITIC. Here we have RIT TBI, that is the incubation center, which is connected to the campus, which is driving the campus also through CIID, where CIID is a entrepreneurship innovation development center, which is traveled through the campus. It is connected to e-sale of the students. Space Club is there. ED courses from first year to last year we have the ED courses. So third year is having some different type of course which is installed. But first year we have course, second year we have course, and final year we have ED track. So that is going to develop, or it is going to create the pipeline of products as well as the startups to this incubation center. Then right side, you can see the skill development center. As I explained, we are connected with the PMKVY, that is Pradhan Mantri Kaushal Vikas Yojana, through technical institution. Then we are developing new budding courses which can be given to the school dropouts as well as the other existing engineering students or any student related to any kind of technology, you can say. We have living labs, as I explained, engineering exploration, then autonomous electric vehicle 4.0. We are working on this industry evolution 4.0 also. So this is a framework we have developed for our TBI, where you can see the chairman is there, Dr. Sushma Kulkarni ma'am, she is also guiding. Here we have advisory board. Then we have alumni, that is RIT Alumni Hub is there, which is connected to local industry. We are getting many ideas, live ideas for the product from all these, from RIT, you can say the RAHA, that is the Alumni Hub, local industries, that they are connected these problems through all these industry as well as RAHA. And with these problems, we are going to make our curriculum. So this is going to be supported for all this VC funding, admin, all other things are coming from this side. And the right side, we are going to connect, I am going to connect all the startups, external startup or internal startup. Left side, Professor A.M. Mullah sir is working for the academic model, which is taking care of ED track as well as the ED courses, Space Club, and all the deans. So what deans are there, HODs are there, all are going to take participation into curriculum development. So these are things which are happening in our campus. Really, when we showcase this campus to state government, and whatever the product we have developed, Dr. A.B. Kakade, Dr. S.K. Patil sir, Dr. Dharwadkar sir, S.N. Yadav, all these are key players of this incubation center who are going to help us to build this ecosystem. So that is how our innovation center as well as incubation center works. Just I want to showcase what is the infrastructure we have made it for this one. This is the infrastructure of innovation center, which is included with the business incubator, that is a NRIT, and really we are providing 120 square feet space to our students to work for all the infrastructure is ready and to work for their innovation only. So that kind of infrastructure we have created. So this is I told you that first year engineering exploration, really the students are going to live problems from the society nearby, and they are coming with the problem statement, and they are developing the real prototype. So till date, in last 3 years, we could able to develop around 240 prototypes from the students of first year itself. We are taking the exhibition from the student, and really that is going to work for the student to coming from idea to product level. So that kind of infrastructure we have made it at our side. This is a skill development center which is inculcated or incubated with all kind of facilitation through our RIT college as well as the incubation center. So all this ecosystem we are trying to develop it in rural area. So RIT, it is based in rural area. We are going to develop the ecosystem in the rural area, and that's what from our side, just RIT side as well as the incubator, and our incubation center is funded by state government for 5 crores. Out of these 5 crores, we have we got 25 lakhs for conducting different types of programs. So this is what about our incubation center as well as RIT side. Now I will introduce our guest, who is also a role model, who can say the role of the incubation centers. He has done a lot many work in the incubation side. He is really he is working as a CEO of IIT Madras Incubation Center. So, and he has written a lot many books also. So books are also available on the Amazon. And basically entrepreneurship related books he has written, and he has done a lot many work for international and national level. So that is the great personality who is delivering the lecture or webinar for today on we can say the role of the startups during pandemic and in future. So just I want to call Muthu sir to deliver the webinar. Just for going not more in detail, just we will understand, we will see you. We are here for hearing you from your side. I welcome Muthu sir, who is the CEO of IIT Madras, and welcome sir, and start the webinar. Thank you.
Thank you for the introduction. Can you see my screen all right?
Yes, you can see.
Okay. So thank you very much.
Yes.
Just to make sure that we don't get it, I am CEO of HTIC MedTech Incubator, not the incubator nor the HTIC, of the Incubation Center at the Healthcare Innovation Center at Madras. Just so no one gets upset.
Yeah, okay.
Okay. So my talk for today is role of startups during the pandemic and the future. So I'll take you through what we feel and what has been talked about. So let's get started. So basically, before we get started, I like all the audience to take maybe 30 seconds to jot down what would they like to achieve from today's topic and talk. So I just keep quiet for 30 seconds, and then I will continue with my PPTs. You can see the PPT in the big screen, right? It's not the presenter mode, correct?
Yes, sir.
Okay, cool. So just before I start, just take down, make some notes. What would you like to achieve today? Okay, the next slide is, let's talk a little bit about the pandemic first. COVID-19, it's led to drastic loss of lives in terms of it's put unprecedented challenges to public health, food system, and the world of work. So many of us are working from home, saying that it also helps us because we are able to do a lot more working from home. So depending on what we do, there's a good part and a bad part about it. The economy and the social disruption it has caused by the pandemic is enormous. Currently, there's around 690 million people undernourished around the world. And this is based on statistics and research. It will raise by another 132 million by end of this year. So it is quite alarming and staggering. The number of people are going to be undernourished and starved over the next few months. Now, reality, nearly half of the working population of the 3.3 are at risk of losing their jobs, because if people are not working, for example, factories and so on are not functioning, then there is no income coming in. So many of these things will not be able to maintain paying salaries and so on. The informal economy workers are particularly vulnerable because of the majority lack social protection and access to quality healthcare and have lost a lot of their productive assets. Without the means to earn an income during the lockdown, many are unable to feed themselves and their families. The pandemic has been affecting the entire food chain and has laid bare its fragility. So we need to be cautious and aware of the food chain. Now, the outcome of pandemic has raised for borders to be closed, trade restriction and confinement measures, and has prevented especially farmers, even in our here in India, of selling in their products. It's become difficult, and agriculture workers from harvesting crops because a lot of them are not allowed to come out. And so this has reduced access to healthy, safe, and diverse diets. So the pandemic has decimated jobs and placed millions of livelihood at restriction. And we've also started losing work from the breadwinners. People are falling ill and dying. So the food security and nutrition of millions of women and men are under threat in low-income countries and marginal population. Especially agriculture workers, wage earners, and self-employed are starting to struggle to get ends to meet. So this is the outcome of the pandemic. Now, even recently, as yesterday, the Nursing Association says around the world, 1,500 nurses have died because they've been working at COVID wards. Recently, there's an article as well, 382 doctors have died of COVID. Medical body says, especially, we are not thinking about them. A lot of them are keeping their lives at risk, especially the frontline workers. So these are news just coming out in the last few days. So you can see we are not away from it yet. It's still causing lots of stress. Now, facts. With low and irregular incomes and lack of social support, many of them are spurred to continue working, often in unsafe conditions, because they need to keep their families running. Experiencing low income, people start to sell their properties at stress, take loans, child labor, all this is starting to increase. Migrant agriculture workers are at risk because their transport, working conditions, and all this are in jeopardy, even though government is trying to put in measures. Guaranteeing the safety and health of all agriculture workers is important because they are the suppliers of the food chain, livelihood. COVID-19 food crisis, public health and employment and labor issues, in particularly for healthcare workers, and safety of their is very, very important, as I showed in the last slide. So as we move on, adverse to workplace safety and public practice ensures access to decent work. So this has to be again addressed. And the actions needed, immediate and purposeful action to save lives and livelihood, should include extending social protection towards universal health, which we speak about a lot in this country, and income support for the most affected. This includes workers in the informal economy and poorly protected, low-paid jobs, youths, older workers, and immigrants. Particularly, it must be paid to situations of women who are overrepresented in the low-paid jobs and care roles. Different forms of supports are key. Cash, child allowance, healthy meals, all this has come to a stop, so need to be looked at. In designing and implementing such measures, it's essential that the government works closely with employers and workers, responding swiftly to the pandemic. Now, what is needed? Now is a time for global solidarity, we say. They all have to work together. So many parts of the world are going into lockdown. They are putting in steps to be united, to work towards getting things happening, bringing things back to normal. So only together can we overcome the intertwining health and social and economic impacts. So this is again a very important topic for most of us to address. We must recognize the opportunity, like the policy brief issued by the United Nations Secretary. We are committed to pulling our expertise and experience to support countries in their crisis response measures and efforts to achieve sustainable development goals. Now, long-term plan. We need to develop long-term sustainable strategies so we will be able to address the challenges facing health and agri-food sectors, as these are the most important sectors among us. The health of the people and to feeding them is primary importance. Priority should be given for food security, malnutrition, rural poverty, in addition to more and more better jobs in the rural area. We must rethink the future of our environment and tackle climate changes. We also need to protect the health, livelihood, and food security. So these would be the long-term plans. What has the lockdown done? The lockdown has been recognized as the only method to control the spread. Even today, you will see some European countries, Australia, have gone back to lockdown. As we are opening, they are going down to lockdown. With the lockdown, there's a lot of psychological change, challenges to the social, education, economical, and it creates devastating impacts on livelihood of people. Impact of the COVID-19 being multiple and not only limited to society at large. Apart from migrant workers, gig workers, it's affecting almost all of us in some way or another. The result, because of COVID-19, the world has become standstill. Many of economies have come to a standstill, saying that many of industries have also succeeded, which I will also talk about in a little while. Moving from economy, the impact of COVID-19 on education has been quite serious. Most of our children are not able to go to school for the last 7 to 9 months, even though schools are slowly going to start opening. The World Bank titled an article, Beaten or Broken, Informality and COVID, says that the closure of the school is going to affect the children in long term, because learning on computer from home may not be the same as learning from a school where other children are there, that there's a direct contact and so on. So this could affect the future of our children who are studying from home right now. With any pandemic or any situation which impacts the society at large, there will always be psychological issues. So mental health has become a very prime importance in today's world, even though we've been ignoring it for a long, long time. Now, the outcome of all this, the lockdown has proven that man is social being, because continuous lockdown of 4 months have impacted people psychologically, and the burden faced by women and children in the form of domestic violence. If you recall, many of the reports now have helplines for domestic violence to be taken care of. So because people are at home, they are sort of lost for what they're doing, they start to have unnecessary problems in this area too. And as India is recognized as land of diversity, impact of COVID is diverse and countless. It has been truly said that crisis gives birth to change, which were pending for many years. So again, this is the outcome of the pandemic. Society needs to change what the government is trying to do hard to implement from past many years. Again, the benefits from this transformation will be limited because of the gaps in the digital connectivity of our country. Not everywhere is easy to access. So going back to the preamble of the Constitution, which says equality, fraternity, integrity, as well as the DPS, to make India a better place on earth for its citizen and world, well, has to be now much, much more focused. Now, I'm now going to talk about what has the pandemic done. Pandemic has actually made many doctors willing to do telemedicine. In the past, it was not allowed. Now today, there's overlooked for these and people are allowed to do telemedicine. So there's a whole lot of opportunities in telemedicine. EMRs have become much, much more usable, much, much more acceptable, and people are interested. Of course, the human touch and connection has been reduced because many of these things are done online. Just like what we're doing right now, we're doing it online. But by doing it online, we're able to get more than 100, 200 people. One of the earlier seminars which I did for IIT, they were able to have live 15,000 people, and then went on for that program for 85,000 people to see that, which would have not happened prior to the pandemic. So there is good and bad, this and everything else. Triaging has become very important. As some of you might know, triaging is used in medical. So there are 3 types of patient. One patient, you do nothing, they'll still survive. One patient, you do anything, they don't survive. And the third one, if you do something, they will survive. Not necessarily that category is always the youngest patient in the hospital. It could be the oldest patient in the hospital. So hospitals, like one of the hospitals in Bombay, has told the young doctors, when you do triage, don't worry about it. It's not you doing it, it's the institution doing it. So you decide on the best course of action. So triaging has become extremely crucial and important in medical fields. Particularly public health in India has become forefront. It has never been for last many years. Sharing of information in terms of drugs, PPPs, have become wonderfully easy today. If you look, when we started the pandemic in March, we had shortages of almost face masks, sanitizers, ventilators, everything was shortage. Today, because of the sharing of information, we don't have any of those shortages. There are probably now too much of those things out in the market. So that is something. Hospital occupation has come down to 30% because people are scared to go to hospital. And I've already talked about psychosocial counseling is also important, and social distancing, not isolation. We should have distancing, but not isolation. We should still interact with others using technology. Now, the effect on the pace of technology transformation. This is so important for you to realize 75% it has actually accelerated outcome. Technology has been doing a great job for the pandemic. 75% is accelerated because of technology. And this is something that would have never happened in the past. 4 Indian companies were given free patent licenses to make drugs. And you can see the pandemic has actually helped big tech companies make lots of money. So most of these big companies have actually made plenty of money. And healthcare has, of course, grown as well. And most of these online activities have grown. So you can see it is not all bad news. There are some good news out there too. Now, what is the future after the pandemic? Most people are going to be using parking lots. Even I'm going to get my license renewed next week. And the guy who's doing it for me told me, you sit and wait in the car park. We'll call you when it comes to your turn. So it's something that's becoming common. Now, car parks are going to be where people are going to wait for the doctor. And once the doctor is ready to see the next patient, there probably will be SMS or phoned and said, you are next, please come in. So this would also reduce the exposures. It will become less hospital-centric. Many of us are now worried to go for our checkups and scared. So because of this virtual care and telemedicine, wonderful opportunity for you startups to come up with solutions. Piracy needs to be a little relaxed. Even in the United States, they've started doing that because if it is too strict, it becomes difficult for people to access data and probably come with a solution. Health boards are going to be important, and e-consulting, particularly for specialists, is going to become a way forward. But all this has to have an economic model. If there's no economic model, no one is going to use them. They will all be self-care will become more important. Many of us will start to take care of ourselves. And as engineers, technology, startups, sensors and devices are going to be leading. And this is something you need to look at. And you need to look at solutions which will enhance human contact. Remember recently when I was also a speaker in a conference where a doctor who had COVID very early on, and he was a doctor at Mass Gen in Boston. And he had said, he's an Indian doctor, but working there, both husband and wife work there, they're both doctors. And he said one of the most difficult things for him during the COVID incident was he was not able to see anybody. His family, his friends were not able to come. And he was only getting food left out and so forth. He felt the way Mass Gen used an iPad was very useful to him because he was able to talk to the nurses or his family through the iPad. So at least there was enhanced human contact there to make you feel better, because you can't be sitting in isolation, and that causes you for a lot of other problems. So instruction to use technology will need to be clearer. We need to be able to make sure data and interoperability is important. So these are some of the things we need to look at. And AI in healthcare industry is expected to become whopping 36 million in the next 5 years. So it's a whole lot of opportunity, and this AI can help us in terms of looking at misinformation, identifying molecules, tracking and forecasting of COVID-19 outbreak. We may not be able to completely eradicate it, but at least we can do analysis where there is a cluster, then we can avoid people going into that cluster. So all this can be done by technologies enabling it all. So lots of opportunities for startups. Now, future after the pandemic. One of the things what we all love to have, just like the new ECG meter was used by GE, it can get an ECG for 100 rupees. That was not possible many years ago. And that little piece of work can now go on ambulance, can be moved anywhere. So people in the rural areas are able to get their ECGs done for less than 100 rupees because all these new compact ECG helps them. So similarly, we need to look at things like CAT scan. How wonderful would it be if we had a CAT scan in a box? We can take it anywhere in the country and start doing scanning, which will help detect early issues in healthcare and solve. Because many people here in India, possibly about 60% or so, do not get their primary healthcare in well taken care of. So that's another area which is lots of opportunity. Collaboration is going to be very extremely important between medical personalities, technology, businesses, and all of them have to work together because of the different skills we need. and it's becoming more apparent during this time. Productivity must go up and costs must come down in order for things to happen. Patients will now call for tests before doctor appointment. Some of us were doing that in the past, but not many people used to do that. So you'd go to a doctor and wait for 4 days to get your results and then go back again. Now you will not go to the doctor. You just have a call. Doctor will give you a set of things to be done. You get them done and then go with the reports to see the doctor. So those are going to become important. Network is going to be important. It has to be fast and quick. And network security will be very useful learning places for health security. And just like any security, you only learn about it when it's bridged. So we can learn from the network security. How do they maintain security network for health security? Very important. Contact tracing is going to be, again, another important piece. If you look at this data from PCG, 14% of companies have improved both in growth and margin during this period. And this is about 3 months, 5 months old, this data. It could even be higher now. So you can see there has been a downturn for 44%, but there has been also 14% of companies have increased sales and margins. This is important. If you look at where are the biggest things growing in, healthcare is going up in tremendous sectors. Communication is going up. So all this helps. Of course, you will be losing at things like most likely transportation and so on. Aircrafts, airplanes, airlines losing money, but there are others who are making plenty of money. So you can see there is opportunity even in these times. And what is machine learning? Machine learning involves artificial intelligence. It enables the system to learn and improve automatically. By doing this, you enable solutions, identifying patterns. It's not like the earlier days where you run through a database and you give a solution. These actually learn from a series of patterns and are able to give solutions which are not in the database. That's what AI does using ML. So thus it gives the system input commands. However, as it said in once in the New York Times, these systems can only be as good as the expert who teaches them. So you need to find the best people while doing this to put in their input so your results are coming out well and good. So this would help us in terms of government, healthcare, in particular, retail, as to find out what people are buying, what will be the future pattern. All this will help retail and automotive industry. The trust area startups can explore. Of course, these are right now a little oversubscribed. Protective gear, masks, ventilators, sanitizers. Of course, vaccine and drug discovery is still lacking. Test kits, rapid test kits, cheaper, rapid test kits, accessible test kits is a way forward as well. So all this is important to look from the startup's point of view. Now, if you look at an AI-based solution to take a look at the COVID patient, if it's an AI-based, the physician is able to match a few of the symptoms with the system. It can take a sample, confirm, patient gets quarantined. He uses his AI to do treatment and monitoring, and they recover. Retest, positive, isolate, negative, cured. So in the other system, the doctor makes lots of guesses. He has to take different aspects. So the system is not able to match what you're doing. So some patients are good at some drugs, some patients are good at other drugs. So with a system help, with an AI-based application, it would help the physician to make these decisions under these conditions, which are very stressful, and it takes up a whole lot of time to make these happen. AI in health will help us in R&D because it will be able to access database to get information to develop better things. It will also help us in terms of regulatory compliance because the database would have all this in it. It will also give us market intelligence, and it will also teach us how to manage scientific information and to make this robotic process automation. So AI is a way forward in healthcare. Now, in what areas can we use AI in healthcare? Obviously, disease identification and diagnostics. Of course, the biggest area we need right now to talk about is getting a drug. So that's discovery and manufacturing them. Of course, imaging helps because machines don't make errors on looking at thousands of images. Humans get tired and fatigued. as the day goes on, we start making errors. So a machine would help us not do that. It will also help in personalized medicine and treatment. It will also study behavioral modification. And we already talked about smart health records, clinical trials, crowdsourcing, radiology, outbreak prediction, and robotic surgery. These are some of the things AI can be of great value, and startups have great opportunity in getting these to the market and looking at some of the challenges in AI. First of all, the challenges, how AI can help, and a use case. Uncertainty in variable supply and demand. It can update in real time. It will accelerate decision making because it has got a digital control. It will also help us in operation and supply because it will be easy to flexible relocate. As I was listening to a story a news report, Toyota in Malaysia was saying they have 30,000 parts into a car. And during this time, they've been having struggles in getting parts because they have several operations. Whatever parts they can't get in Malaysia, they can get it from their suppliers in Thailand and move together. So having all AI will tell them which of their plants have these parts and can be shifted. So these are real-time value chain. So that what he said is exactly what AI will do. It will also help locate workers from one area to another. So it helps you work out where there's no work in one factory, you can move them to another place. It works in almost every scenario. It will also talk about changing patterns of consumers in real time. So you'll be able to make and produce or keep supplies of what is actually selling. The benefits of AI in medicine: it assures quality, it will be consistent, it's better patient hospital management, it reduces error, as I said a couple of minutes ago. When it's mundane work, us humans make lots of mistakes and we get bored. However, machines don't make that mistake. They are repetitive, and it will reduce a lot of the manual work, and it will be very precise in data extraction and proper and continuous monitoring. It will benefit risk analysis. It will also be able to store complex data in cloud and secure your data for capture. So ways AI, data science, and technology are being used to manage and fight COVID-19. First is to identify and track and forecast outbreak, a powered system to help diagnose the virus, process healthcare, and reduce face-to-face interaction between patients and hospital staff. Some hospitals are already using drones to deliver medical supplies. We can use robots to deliver medicines, food to the patient, so it is sterilized, so the virus doesn't travel or transmit. It also predicts existing drugs, what may be useful. It can also look at antipathogens, antibacterial fabrics, AI to identify non-compliant, so infected individuals, it can monitor. I mean, there are camera softwares today can actually monitor and say the social distancing is not happening. Chatbots to share information, supercomputers working on virus vaccination. All this is what data science and technology are doing and helping in managing the COVID-19. This is another use, for example, of AI in the post-crisis world. We need robots which can do lots of work at the factory, help it run 24/7. It has to enable AI platforms. It will also help in detecting hyper-personalized production. As if you see already, we all use AI. If you're using Amazon, Uber, any of these applications, they all work on AI. Sometimes you'll get an offer from Uber that you will have the next 4 trips free, because you've been going so much, so they keep encouraging you to become sticky to the product. So all this is done through their algorithm, which AI. They have AI in it. Even when you shop in Amazon or Flipkart, it will say, customers who bought this also looked at this. So when things are thrown at your face, you get impulse buying. So another way of doing this, all through AI. Now, new reality. Uncertainty requires redundancy. So AI will create and minimize cost. And consumption patterns are moving towards e-commerce. Many of us are buying things from home. We're not going out. For example, I have not gone out the last 7 months of my house. Most things I do online. So it is helping. Consumer behavior is changing. So a lot of AI needs to require an R&D and innovation. And remote ways of working are becoming new norms, just like us. I am giving this talk thousands of miles away, not only in India, even in North America, and even in in Southeast Asia, where people invite me now easily to speak because I can do that from home. We save time, we save cost, and we get a larger audience. So it is all important, very, very important. Now, what is after? I've already spoke about rapid test kitting is going to be very, very crucial. We're going to talk about contact applications. They're going to be very important, and contactless devices. Even some of my doctor friends have been telling me patients are worried when they use the stethoscope because stethoscope has been used by someone else. So a contactless stethoscope is going to have lots and lots of market in this new area. We need to improve the fairness of data. It's important, and that we use AI and machine learning, code checking. We need to validate the existing models. We improve our confidence and recommendation. Now, power the startup community holds. Startups are agile. They're flexible compared to larger organizations. They can pivot quickly. They can change. They can create new jobs. They can hold. They can help startup investment in innovative for the future and hold the power of disruptive market. And their power to deploy fast. They don't need to go through too many things. Technology startups play a huge role in innovating for the quarantine companies. Corporate might have to shade attitude. You benefit and I lose. And adopt, we share, we both win. We provide superior experience to customers. So all this is important for startups. Now, 5 principles for building a human-powered company. AI-powered company, sorry. First thing, the leadership will have to come on board. Just like this program you're doing. If the people who are organizing this were not prepared to do this online, then we cannot do this. But it has to be reimagining the organization with AI at its core. You need to transform the human power into an AI company. And you need to contain or retain legacy processes. And you prepare people for the change. So these are some of the things AI will have to do. Trending applications in AI in the industry. I will not go through in detail. I'm just going to show you how many people are working on these areas. Smart records, you see so many of them are working, all have raised humongous amount of money. So there is lots of interest. Medical imaging and diagnostic, Microsoft is getting involved. The AI is getting, all these companies, large organizations are getting involved in it. Drug discovery, you can see Pfizer, all this is happening. Lots and lots of money is put in. Medical data, treatment and prediction of diseases is important. Another set of companies doing this. And these are companies trending in AI. Again, all are startups. Some are from India, some are from the North America. We are still lacking, but they're still happening. Again, other startups here in AI. And what do we learn from the crisis? Very important. First, businesses cannot wait for transformation. It knows it needs to change. We need to change. Working from home is something is going to become normal. Many IT firms are already speaking about this because infrastructure costs in a city like Bombay, Delhi, Chennai, Hyderabad, Bangalore, it costs a whole lot of money. So getting rid of those buildings will save and bring more profit to these organizations. Many, many years ago, when I was working with British Telecoms, we used to offer people money to work from home because the infrastructure costs, likes of London, used to be so expensive. And we would used to ask them to work from home, and they would have an office set up made in the office for them in the house to work from home and come into office only once a week for a briefing. So that was to reduce costs. What's happening, this is over 20 years ago when property prices were staggeringly high in the city of London. So British Telecom was trying to move people to work from home. And because they did that, many people lived outside London. So they were able to have better lifestyles. They were able to have better property because property was cheaper outside the main city of London. So that helps working from home. And leadership has to value matter always, but especially in crisis. That's why a lot of larger organizations, when they're reducing people, when they don't have to, some people complain. Why do it now when you're losing money? They all made you money, so you need to take care of them. So this is something leadership will have to do. And meaning of the word essential is becoming very, very crucial for us. Now, the biggest problem with many of our startups is that, just like this Buddha saying says, the biggest communication problem is that we do not listen to understand, we listen to reply. So the startups have to listen and respond with their solutions. It's no point doing something I fancy and nobody wants it. So I got to listen to those little signals out there and then build my solution or product on these activities. I have covered mostly on healthcare because healthcare is what is going to be happening and is very much needed in our country, as many people do not have access even to primary healthcare. So this is an area we can put in, our startups can play a huge role to help make the healthcare better. So what is next? We need to identify the key takeaway from my lecture, what you've picked up, how does it relate it to you, and how would you share it with others? These are 3 things I'd like you to ask you to do. And this is the contact slide for me. I respond to all my emails very timely, often instantly. My email is muthu.singaram@vibrozone.com. My telephone number is 97909322420. Several of our books are in Amazon. You can pick them up if you stick my name, Muthu Singaram. And we have a YouTube channel. Sometimes, at one time, I was regularly uploading, but right now I'm overworked, so I have not been uploading for some time, and will upload whenever I get a chance. So I'm open for questions and answers. With that, I think I took about 35 minutes, 40 minutes to do that. And I am now open to take questions. And anyone who wants to talk to me or wants to reach out to me, you're most welcome. And that's my contact details. And if you miss it, if you Google my name, you will get my contact with absolutely no difficulties. So I would like to thank the organizers for giving me this opportunity on this very fine morning in Chennai. It's been raining all week, but today it's beautiful and sunny, and it's wonderful to be speaking to you. I really appreciate that. And over to you, Suryakant.
Yeah.
Yes, sir. Thank you
I'll
so
take the
much.
question.
Thank you so much. I will request Sandeep sir to take over the question.
Yeah. Thank you, sir. Thank you, Suryakant sir. Thank you, Muthu sir, for such a wonderful session. So we have some questions. We have audience listening your sessions, and they are keen to have some questions to you. So I'm taking first question from Mr. Tejas Fase, who's the audience, who's a participant. So he's asking about which skill set do we need to equip other than tech skills after this pandemic? Can you suggest some of those?
Yes,
Yeah.
not only the pandemic, at any time and moment, we need to have managerial skill, we need to have people skill to run startups. Startups are not just based on technology. That's why you would always see the successful companies will always have somebody who knows how to manage customers and somebody who knows how to do tech. Let's take an example of Apple. Steve Jobs was very good in taking things to market. Technically, Steve Wozniak was much better and he made sure things happened. So that's an example. Same with HP. One of them was very good in taking it to market. The other was very good in technology. So we need marketing skills, we need management skills, and we need people skills. So if you look at the larger organizations, they always have the leadership. They know how to manage people, and they tend to be more successful. So if you take an example of Infosys, they have done extremely well because they've always managed their people extremely well. So these are some of the important factors they would have to learn. Is that?
Thank you, sir. Thank you so much. One more thing, there is one question from my side itself.
Please.
As an early stage startup founder, what do you think, in which area they need to focus? As you mentioned everything about the healthcare, that is true. But in case suppose any early stage startup founder is working on some of the product development, how the incubators are going to help them in case of product development and sustaining it ahead for the into the market? So can you elaborate what are the support systems provided from the incubators? It may be your incubator or some other incubators. So what is the general guidelines or the support systems given by the incubators for the early stage startup co-founders or early stage innovators?
Okay, good question. Now I spoke about healthcare because healthcare is right now with plenty of opportunities, but rightly said, there are other opportunities too. So in terms of product development, you need how to test it. You need how to take it to market. So your incubator should be able to at least help you get regulatory, help you out, not actually get it for you. Please remember, it's not the job of the incubator to do anything. It is their job is to only support. They should be able to guide you where to get regulatory, how to test your products, how do you go marketing. giving you mentoring support, giving you equipment support. The word is support, not doing it for you. And startups should not be coming into the incubator thinking the incubator is going to do everything for them, because that is not the job of the incubator. The incubator is a facilitator. The incubator will help them, support them, guide them. That because the product or service is the startups, is not the incubators. So unless the startup moves it, no one else is going to move it. So please be cautious. As incubators, your role is to support, not to make it happen. The making it happen has to come from the startup. You can give them equipment, you can give them space, you can give them expert advice, you can guide them. That's your role. Okay.
Yeah. So there is a next question from OPEX India, that how pharmacy institutes can contribute in healthcare startup ecosystem.
Pharmacy, what, sorry, pharmacy?
Pharmacy institute, pharmacy colleges can
Pharmacy,
contribute in healthcare startup ecosystem.
pharmacy colleges obviously can help us in terms of drug discovery, diagnostics, diagnostic kits, assessing. They could work on those things. They could help them on those things in terms of drug discovery, helping in doing rapid testing. All those things can come from pharma colleges. Yes, it is very pharma startups are very expensive. So it may be difficult for startups to get into pharma drug discovery, because usually for a drug discovery, they spend millions of dollars. So startups may not have that sort of feeling for drug. And furthermore, they may not have the expertise. So they'll need to probably work with some other organization, who has some kind of requirement, and maybe they can work from the requirement. So maybe like test kits, those are probably doable from pharma colleges.
Okay, sir. Sandeep sir, if there is any question, otherwise we'll go for a vote of thanks. Sandeep sir. That will be the case. Now, we are ending over to the session. So thank you very much, sir, for giving us insights about the pandemic and its role, impact to the world. In short, I can say there are a lot of opportunity for startups during and after the pandemic. You also elaborated about different sectors where there are a lot of opportunity to the startups, like AI, ML in future and in current pandemic period also. So with these words, I'm thankful to you, sir, Muthu sir, because you have taken a lot many efforts for us, and it was a very insightful session, and it was very useful to our startup. Definitely, it is going to assure that there are a lot many advantages or a lot many problems the startup has taken into their account from your side. So I'm very much thankful to you once again. I'm thankful to our management, Dr. Sushma Kulkarni ma'am, then Dr. S.K. Patil sir. So a lot many faculties are there, S.T. Jadhav sir from our college. And last but not least, I am very much thankful to our leaders in IES, and whatever the effort we are taking, that is useful to lot many faculties, lot many students of this Maharashtra, as well as we want to expand this IES session, IES forum throughout the India after we cover the RIT, after we cover Maharashtra. So that's all from my side. Thank you so much to all of you. And I can say now the session is over. So thank you so much to all of you once again.
Thank you very much for having me here.
Yes, sir. Thank you,
sir. Thank you, all of you. January.